Key features and anatomical relations. The zygomatic bones or cheek bones are a pair of quadrilateral bones found along the anterolateral aspect of the cranium. They are classified as irregular bones, provide the skeletal framework for the cheeks, and contribute to the formation of the orbits and viscerocranium. Each zygomatic bone articulates with the frontal bone, sphenoid bone, temporal bone, maxilla, arterial supply, zygomatic orbital artery. Parts of zygomatic bone. 1. The frontal process is the thick superior projection found on the upper aspect of the zygomatic bone. Provides attachment sites for the lateral palpebral ligament and temporal fascia. 2. The maxillary process is the pointed, anteromedial projection found on the anterior aspect of the zygomatic bone. The maxillary process contributes to the formation of the floor of the orbit. 3. The temporal process is the thin posterolateral projection found on the posterior aspect of the zygomatic bone. The temporal process provides an origin site for the masseter muscle and an attachment site for the temporal fascia. 4. The zygomatic-ofacial foramen is a small, round, anterosuperally located opening found on the lateral surface of each zygomatic bone. It allows for the passage of the zygomatic-ofacial artery and the zygomatic-ofacial branch of the zygomatic nerve. 5. The zygomatic orbital foramina are the two small, round openings found on the orbital surface of each zygomatic bone. The more medial of the two zygomatic orbital foramina allows for the passage of a zygomatic-temporal artery and a zygomatic-temporal branch of zygomatic nerve, which travel posteriorly through the zygomatic bone and exit it via the zygomatic-temporal foramen. 6. The zygomatic-temporal foramen is a small, round, anterosuperally located opening found on the temporal surface of each zygomatic bone. It allows for the passage of the zygomatic-temporal artery and the zygomatic-temporal branch of the zygomatic nerve. Surfaces of zygomatic bone. 1. The lateral surface, facial surface, or malar surface is the subcutaneous, convex area found along the anterolateral aspect of the zygomatic bone. It is one of three surfaces of the zygomatic bone, the other two being the temporal and orbital surfaces. The lateral surface consists of the zygomatic-ofacial foramen and provides origin sites for the zygomaticus major and minor muscles. 2. The masseteric border, masseteric margin, inferior border, or inferior margin, is the thick, rough, posterior-inferiorly located margin of the zygomatic bone. It extends posteriorly from the maxillary process to the temporal process of the zygomatic bone and is continuous posteriorly with the inferior margin of the zygomatic process of temporal bone. The masseteric border of zygomatic bone provides an origin site for the masseter muscle. 3. The maxillary border, maxillary margin is the rough, antero-inferiorly located margin of the zygomatic bone. The maxillary border of zygomatic bone articulates with the zygomatic process of the maxilla, forming the zygomaticomaxillary suture. 4. The orbital border, orbital margin, is the smooth, concave, anterosuperiorly located margin of the zygomatic bone. It separates the lateral and orbital surfaces of the zygomatic bone and contributes to the formation of the infraorbital margin. 5. The orbital surface is the smooth, concave area found along the supromedial aspect of the zygomatic bone. It is one of three surfaces of the zygomatic bone, the other two being the lateral and temporal surfaces. The orbital surface consists of the orbital tubercle and the zygomatic orbital foramina. It contributes to the formation of both the floor and lateral wall of the orbit. 6. The sphenoidal border sphenoidal margin is the thin, serrated, posteromedially located margin found along the frontal process of the zygomatic bone. 7. The temporal border temporal margin is the smooth, postero-superiorly located margin of the zygomatic bone. It extends postero-inferiorly from the frontal process to the temporal process of the zygomatic bone. The temporal border of zygomatic bone provides an attachment site for the temporal fascia and contributes to the formation of the antero-inferior boundary of the temporal fossa. 8. The temporal surface posteromedial surface is the smooth, concave area found along the posteromedial aspect of the zygomatic bone. It is one of 3 surfaces of the zygomatic bone, the other 2 being the lateral and orbital surfaces. Landmarks of zygomatic bone. 1. The infraorbital margins are the 2 prominent, curved edges that form the inferior portion of the opening of each orbit. On its corresponding side, each infraorbital margin. 2. The orbital tubercle orbital eminence, marginal tubercle, or Whitnell's tubercle, is the small prominence found along the orbital surface of the zygomatic bone. It is located inferior to the zygomatica frontal suture and provides an attachment site for the lateral palpebral ligament. 3. The temporal fossa is the large, shallow depression found along the lateral aspect of the cranium. It is formed by the frontal, parietal, temporal, sphenoid, and zygomatic bones. The temporal fossa is continuous inferiorly with the infratemporal fossa, consists of the pterion, and provides an origin site for the temporalis muscle. 4. The zygomatic arch is the curved, horizontal, bony bar found along the lateral aspect of the cranium. The zygomatic arch contributes to the formation of the cheek and the antero-inferior boundary of the temporal fossa. It provides an origin site for the masseter muscle and an attachment site for the temporal fascia. Sutures. 1. The frontozygomatic suture zygomatica frontal suture is a fibrous joint found along the anterolateral aspect of the cranium. It is the articulation site located between the zygomatic process of the frontal bone and the frontal process of the zygomatic bone. 2. The sphenozygomatic suture, zygomatus gonadial suture, is a fibrous joint found along the orbit of the cranium. It is the articulation site located between the zygomatic margin of the greater wing of sphenoid bone and the frontal process of the zygomatic bone. 3. The temporozygomatic suture, zygomaticum temporal suture, is a fibrous joint found along the lateral aspect of the cranium. It is the articulation site located between the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. 4. The zygomaticomaxillary suture maxillozygomatic suture, or infraorbital suture, is a fibrous joint found along the anterior aspect of the cranium. It is the articulation site located between the maxillary border of the zygomatic bone and the zygomatic process of the maxilla. Craniometrics. 1. The ectoconchon is a craniometric point found along the anterior aspect of the cranium. It is the most lateral portion of the orbital margin. 2. The zygon is a craniometric point found along the lateral aspect of the cranium. It is the most lateral portion of the zygomatic arch. 3. The zygomaxillaire is a craniometric point found along the anterior aspect of the cranium. It is formed by the maxilla and zygomatic bones and is located at the inferior end of the zygomaticomaxillary suture. 4. The zygoorbital is a craniometric point found along the anterior aspect of the cranium. It is formed by the maxilla and zygomatic bone and is located at the area where the zygomaticomaxillary suture meets the orbital margin. If you found this video helpful, give it a thumbs up and share it with friends and colleagues who might benefit from understanding more about the mandible. Together, let's spread knowledge and foster a community passionate about dental health.